AI in healthcare feels like magic sometimes. Machines that can spot diseases, predict risks, and even guide treatments. But behind every smart diagnosis is a foundation built on data labeling. Without it, AI wouldn't know the difference between a harmless shadow on an X-ray and a sign of something serious. Think about medical imaging. Doctors spend years learning how to recognize the smallest details in an MRI or CT scan. For AI to do the same, experts have to label thousands, sometimes millions, of images, marking exactly where a tumor starts and ends, what healthy tissue looks like, and what patterns indicate disease. It's that human annotation that trains AI to see like a radiologist. Companies like Siemens Healthineers and GE Healthcare are already pushing these boundaries, using annotated data sets to build AI tools that support radiologists in making faster, more accurate diagnoses. It's not just imagining. In healthcare, context is everything. A phrase in a patient's notes like history of diabetes doesn't mean the patient has diabetes now, but AI might assume so if the text isn't properly annotated. Human experts make sure medical data is labeled in a way that captures nuance, so AI gives reliable, safe recommendations. This is exactly how platforms like IBM Watson Health and DeepMind Health are harnessing data annotation to turn raw medical notes into meaningful insights for better patient care. Even wearable devices, those smartwatches tracking your heartbeat, oxygen levels, or sleep, depend on labeled data. AI can't just assume what a normal heart rhythm is. It has to be taught using real patient data annotated by cardiologists. That's how it learns to detect irregularities early, sometimes before you even notice symptoms yourself. Companies like Apple, Apple Watch, and Fitbit rely heavily on annotated health datasets to make their monitoring features truly life-saving. And then there's drug discovery. AI scans massive datasets of chemical compounds, but it needs annotated data to understand which patterns are linked to successful treatments and which aren't. Human annotation helps AI avoid costly mistakes and speed up the development of new medicines. Pfizer and Novartis are already using AI systems trained with carefully annotated datasets to identify new therapies faster than traditional methods. At Beyond Human Intelligence, we've worked with datasets that train AI to be more accurate in diagnostics, safer in recommendations, and more efficient in clinical research. We don't just feed machines data. We teach them how to understand it in ways that align with human health and safety. So the next time you hear about AI catching a disease earlier than a doctor or helping create a life-saving drug, remember, it wasn't luck. It was built on carefully labeled data, guided by human expertise, making healthcare not just smarter but also more human-centered.
You learned something new. Tap like, hit subscribe, and drop a comment below. See you in the next video.